My name is Gavin Fox-Smith. I'm the CEO of an Australian-owned private MedTech company called Omnigon. I'm also the chair of Australia's Digital Health Accelerator and Health, and am pleased to sit on some other boards in the health space. First of all was the opportunity to enter the MedTech environment. And that was way back in 1986. And I was lucky enough to join an orthopaedic company called Medica, which is now part of the Stryker organisation. And that was a company that was all about innovation. It was all about growth. It was very customer focused and it was very people focused. And I think that early experience was pivotal in my own career. After Medica, I was able to join Johnson & Johnson, and I joined Johnson & Johnson at an interesting stage of their development in Australia where key account management was becoming a big part of their organisation. And key account management was fundamentally about understanding the economic decision maker. And Johnson & Johnson was the lead company in that space. And we learned a lot about dealing with the economic decision maker. So again, a great learning and a great environment to further develop in the MedTech sector. Over the course of my career at J&J, I was very fortunate to take on a number of different roles. And probably the two most important, well, maybe not most important, but most impactful roles, I think, were when I took on my first general management role, and that was for the great brand of Ethicon. And that was very much a time where the healthcare environment was under funding challenges. It was in the very late 2000s, heading into 2010, 12. And we had to create not just a brand, but we had to create a clinical and economic story on why all sutures weren't the same. The next pivotal moment for me was really taking on the managing director role at Johnson & Johnson. In many ways, it was a life goal and a life ambition. And I was fortunate enough to do that role for 6 years. And over the course of that time, I really embraced the concept that business can do good in all sorts of ways. And I was able to not only lead a wonderful MedTech organisation across Australia and New Zealand, but we were able to be a strong voice in the community, a strong voice for our industry, and also a strong voice for social progress. Most recently, and in my current role, I've really begun to understand the small company environment in the MedTech space. And when you reflect and you look, and I was fortunate to be the chairman of the MTAA for a number of years, the majority of companies in the MedTech space are small to medium enterprises. And I currently lead an organisation of 22 people, and I have been in the role for nearly 2 years now, and I am learning all the time about how do you make decisions in a small company environment. Omnigon is a 28-year-old company. It was founded by Australians, and those 4 Australians are still involved with our business as owners. And it was set up with the exclusive focus of caring for patients with stomas or ostomy care. And a stoma results from either colorectal surgery of some description or gut diseases like Crohn's, colitis, or indeed trauma. and in some cases a stoma can result from people with disabilities, and bowel care is easier managed through a stoma. Omnigon is a distributor of 3 global brands. We distribute product from an Irish company called Econ, an English company called Wellen, and many of you will know the German company B. Braun. We distribute their ostomy products across Australia and New Zealand. We also have a proprietary range of products called Omnigon support garments, and they are used in the management and hopefully the prevention of hernias in stoma patients. I took on the role as CEO and really their first CEO, and it has been a great journey so far. I talked a little bit earlier about the purpose of MedTech, and the purpose is very deep and very important in our company, and that is about enabling ostomates, or people that have a stoma, to live their best lives across Australia and New Zealand. And our team do that every day. We have a broad range of products, given that we distribute 3 principal suppliers. We work with the ostomy associations. So the model for distribution of products in Australia for stoma patients through ostomy associations. And we also work with our primary clinical call point, who is a stomal therapy nurse. Our team is split pretty much half in the field and half in the office. And we are a company that outsources our supply and distribution in both Australia and New Zealand. I think giving advice is always fraught with danger, because I guess you can only give advice based on your own personal experience. In the organisations that I've been very fortunate to work in, my first, bit of advice based on my own personal experience is take the opportunity. Don't be shy about putting your hand up. Don't be shy about taking on opportunities bigger than you think you may be ready for. And get involved. You know, I think one of the great things about our business is our jobs, by definition, are hugely satisfying. Our industry has always had great purpose, and that purpose almost every time is centred around the patient and centred around the healthcare professional that helps deliver the care to the patient. There are other things that our business and our companies and our industry can do, and I think that's been amply demonstrated in recent years. We support patient voices. We support advocacy for appropriate regulation and appropriate reimbursement in our industry. So from a career perspective, put your hand up, take some risks. Yes, you might fall down a couple of times. You might find yourself even failing. I think failure is simply one of the steps one needs to take in your career. But MedTech is still a little bit of a secret, because it's a great place to be a sales rep. It's a great place to be a marketer. It's a great place to be a supply chain professional. It's a great place to be an IT expert. And our businesses, large, small, innovative, mature, we all contribute to making Australia a happier, healthier place to live.